Hello, this PowerPoint and resources to help you understand the importance of communicating transparently while maintaining safety and privacy of the students. We've provided a couple of phone scripts, two that if you receive incoming phone calls, and one that if you need to make an outgoing phone call regarding exposure to symptoms or COVID-related exposure. The first phone script is if a parent calls in to excuse their student and openly reports the symptoms related to COVID-19. In this case, we use the J code in Aspire to mark their absence. It's important at that time to ask questions. For instance, to your knowledge, has your child been exposed to someone who has been tested positive for COVID-19? If they respond yes, to then ask them if they've been in contact with Tri-County Health Department, and if not, to call them immediately. For instance, Tommy, then you would talk to the parent about, your child, we'll use Tommy in this incident, must quarantine for 14 days and return when all three of the following situations have occurred. For instance, they no longer have a fever for at least a period of 24 hours without the use of medicine, and all other symptoms have improved, as well as at least 10 days have passed since their symptoms first appeared. Or if they have received a physician's note or documentation that their symptoms are not related to a communicable disease, they may return with that doctor's note. Another reason that would allow them to return without that full quarantine of 14 days is if after at least 7 days following their first symptoms, they receive a negative COVID test and provide that documentation. If they respond no, follow the same script above, but it's then a 10 calendar day quarantine. Phone script number 2. If the parent calls to excuse the student for the day due to an illness, ask them, will you allow me to ask you a few health screening questions? If they respond yes, ask them, has your daughter or son suffered from any of the following? And they go through some of the symptoms, for instance, their temperature, sore throat, cough, illness, so it's related to shortness of breath, or any decrease in their sense of smell or taste. If they respond yes to any of those, use the J code and follow the same script as you used in scenario number 1. If they say no to the screener, or if they answer no to all the questions, it's a P code and they can return to school when they are well. This is important to note in this situation. Don't get into battles with parents. If they say no to the screener's questions, or if they just tell you it's none of your business, just mark them as a P. What if a student is exposed at school to the COVID-19? The following phone script may help you here, and I would utilize it to maintain the safety and privacy of the student, as well as to help communicate transparently. Because it's important that employees must maintain that confidentiality of the health-related information while assisting the health department or needed to contact others who maybe have been exposed. For instance, we're calling to let you know that your son or daughter may have been exposed within 6 feet or 15 minutes of longer of an individual, possible student or employee who's tested positive for COVID-19 in the last X amount of days. We have let them know that you've also contacted the health department and that the custodial staff is thoroughly cleaning and disinfecting the areas. And then also that it's due to privacy and laws protecting privacy that we can't disclose the name of the individuals who have been tested positive. Then proceed to, let them know however you'd like to let them know about the incident so that they can contact their healthcare provider for medical advice. And then proceed to tell them that students who have been exposed must quarantine for 14 days from the last exposure. Also inform them that they should monitor their student and provide any resources related to symptom monitoring for the parents and families to support them in that. but let them know they should monitor their child in case he or she develops any of the symptoms, including fevers, coughs, chills, muscle aches, or sore throat, headaches, or an upset stomach. And should one of these symptoms happen in your child, they should be tested for COVID-19, and if they test positive, to then isolate and follow the instructions of the health department. A reference that you can use for this information is found on page 6 of the current COVID-19 school manual. An additional resource underneath the scripts, assurance number 26, is the PowerPoint that you just viewed, as well as the document that I have linked in here that provides you with these scripts that you can print out and have available for your secretaries. Thank you.